Welcome to Invited Back. My name is Sabbath Kapahu, and we are in a deep dive mini-series based on the session at Stimulate Summit. We're going to continue the conversation about understanding pelvic floor health. We talked about an overview of the discussion that Dr. Tao shared with us inside Stimulate Summit. And as for those of you who haven't gotten a chance to watch that video yet, go back and watch the video and remember to like, subscribe, and comment, because we want these conversations to be shared with as many people as possible. The goal is to be encouraged, gain confidence, and build stamina. So as a reminder, people are living with pelvic floor dysfunction, such as incontinence, constipation, pain with sex, and menstrual cycles. And if you are experiencing any of those, they're potentially debilitating symptoms, then it affects the quality of our daily life. And Dr. Tao reminded us, shared with us, encouraged us that something can be done. So if you've noticed that something doesn't feel right, it feels like maybe it's not a big deal, but you've made some significant changes once you start feeling that, then it's a big deal, and it's something to talk about with medical professionals who are caring for us. Okay, so I am not a medical professional, so the exercises that I'm going to go over today were from Dr. Tao, and this one in particular everybody can do, which is why I'm sharing it with you, which is why she shared it with us, because it's a great reminder to breathe deep. She shared with us an exercise that she does with patients that come in to see her. It's called diaphragmatic breathing. And so she told us to, when we do this by ourselves or with your partner, you lie on your back. Obviously, I'm not going to lie on my back as I'm sitting here with you guys, but you can imagine what that space, what that feels like, okay? With your knees bent and your feet flat on the surface, okay? Knees bent, feet flat on the surface. And you are going to place one hand on your chest and the other on your abdomen, okay? I'm gonna just put it right here and show you. So she told us to slowly breathe in with your nose. And exhale slowly through your mouth. She said that the hand on your chest should have minimal movement as you inhale, while the hand on your abdomen should rise. Now, I'll share a clip of this in a few weeks, but she actually scolded me while we were talking in our interview because my hand on my chest moved like this. And that means that I wasn't breathing with my diaphragm. And she was saying essentially what is happening through this exercise, and when we choose into diaphragmatic breathing, is our pelvic muscles should relax, and they should have a blooming or flowering movement happening. And when we exhale, our pelvic floor muscles should recoil back. So what's happening is that our breathing, the exercise of breathing, the thing that we do without thinking about it every second of every day, has a direct connection to our pelvic floor. Our diaphragm and our pelvic floor work together to regulate pressure. What an amazing thing to realize. Everything inside is connected. So if there is an issue here, even she was saying to reconnect your breath with your diaphragm and pelvic floor, that is something that a physical therapist can help you with. Something that we might not have ever considered, but how our pelvic floor and our breathing is connected. And if the way that we're breathing, the diaphragmatic breathing, is off, there is someone out there in a physical therapist that could help us. So If you don't have anybody in your life who you feel like you could reach out to, you can reach out to Dr. Tao. She's on social media, and the links to her social media channels will be below, and she welcomed us to email her with any questions. In fact, speaking of that, we are going to have her back on here on the YouTube and the podcast. So if you do have questions regarding pelvic floor health, you can go through her social media channels. She posts such amazing content, things that may be a little bit taboo, but are so vital to our daily life, which is why I so appreciate the work that she's doing in educating men and women, and even content for children. The reality is that pelvic floor dysfunction has no age discriminant. So there's effects on young kids, and there's effects all the way up to the elderly. And there are also solutions for everybody and everyone in between. So speaking of solutions, we're going to talk about some resources that she shared with us. And I'll have the links below to these websites and these social media channels. They are from doctors of physical therapy who are having the conversations, who are sharing their wisdom freely and adding so much value. So here's a list of the physical therapist accounts that Dr. Tao recommended to us. And I have to say, I am following some of them, not all of them, and they are teaching me things daily. So check them out. If it sounds like something that's not for you, don't check it out. It is completely your choice, all right? The Vagina Whisperer, Dr. Sarah Reardon, DPT. Again, the links will be below. Vagina Rehab Doctor, Dr. Janelle Howell, DPT WCS. Dr. Susie G, Pelvic Pain, the Ultimate Cock Block. That is the name of her book. In the last episode and video, I talked about the reality that our husbands, the men in our lives, have a pelvic floor, and it is just as vital for them to be taking care of their pelvic floor as well. So Dr. Susie G focuses her practice as a DPT on men's pelvic floor health. Again, the links will be below. There are some treatment tool websites that I wanted to share with you. And again, the reality is we are probably in the midst or dealing with pelvic floor dysfunction ourselves. And it's wise to get help from a physical therapist or your doctor before you start treatment, okay? But there are treatment tool websites out there that we wanted to share with you. So one is called Intimate Rose. Again, the link will be below. There's dilators, pelvic floor wands, Kegel weights. You might be kind of mind blown as you hear me say those words. They are there and they are treatment tools, not taboo, treatment tools. The other website that has treatment tool options, Kegel devices, is PeriFit. Again, we will put the links below. There is another one called Squatty Potty. And the reality is maybe having a toilet stool will help with your pelvic floor health. And so I'll put the links below. Again, I want you to have the conversations that matter most to our health and well-being, to our ability to be encouraged, gain confidence, and build stamina. So ask questions below and connect with us on social media. Again, Dr. Tao's contact information will be below, and you can DM her, and you can send an email to me at any time or DM me. My contact information is below. This is a space to reimagine the possibilities when we give ourselves permission to reinvent the way we have conversations about the things that matter most, and the way we reinvite our partners, our communities, our families, our friends into these conversations. That is why I started Simulate Summit. That is why we're following up with these conversations based on session topics. So send in your questions, because we will have Dr. Tao back on to address those. Until next time, aloha.